Now today I will discuss a very important disease subject, that is epidemiology. You have heard the name epidemiology. Epidemiology is very important for a doctor because until and unless you know epidemiology, you cannot be a good clinician. Okay. Now if we just break the word epidemiology, it has three parts. One is epi, middle part is demo, and last part is logy. Epi means upon. Demo comes from the word, Greek word, or Latin maybe, demos, from where we know democracy, demography. It means people. Demo means people. And logy, it is the study or science. So in one word or in one sentence, we can say epidemiology means it is the study among the population. That is the thing. Without population, nothing is in vain. You got chances in studying this course. You learned 5 or 6 years. You have done practice, you learned everything, anatomy, physiology, medicine, surgery, gynae, everything. But you do not get population, people. It has no meaning, it is in vain. So population is the main thing which a doctor has to deal. Not only doctor, everything. Everything is, the politicians are open, always saying that we are the servants of population. We are doing everything. I am Prime Minister because I am a sevak. Is it so? No. सेवा करने के लिए आया है? No. It is for his own interest. Not only PM, all, CM, everything, every politicians. And कुछ कमाने के लिए. ठीक है? So anyhow, we must learn epidemiology by remembering the sentence, it is the study among the population. Different authors, scientists has given different definitions in different times. The first definition is the study of distribution and determinants of disease frequency in man. It is given by McMahon in 1960. Okay. So, in your examination, your oral examination is very important. So, your oral examination may start with this question: what is epidemiology? It is the favorite first question of many external examiners. So, you must learn and remember at least one definition. And in my opinion, the easiest definition is the first definition. That is the study of distribution and determinants of disease frequency in man. It means it is a study in man, it is clear. And study of what? Distribution, how the disease is distributed. Disease is not equally distributed in all the parts of the world, because we know breast cancer is more in Scandinavian countries like Norway, Sweden, and stomach cancer is more often in Japan. Hypothyroidism is more prevalent in India. Gastroenteritis and waterborne diseases are more prevalent in India, Bangladesh and Pakistan, where the food hygiene, water hygiene is very poor. You cannot expect a cholera case in USA, but it is very often found in India, often in Kolkata, in cholera case. Why? Why there is difference in the distribution of different diseases in different areas of the world? As I have given the example of breast cancer, gastric cancer, diarrheal diseases. It is a matter of study of epidemiology. So this is the distribution of the disease. Second thing is the determinants. What is the meaning of the term determinants? Determinants means the factors which determines the health. That is the factors responsible for good or bad health. So you have to study this. And also the frequency. Frequency means number. One is frequency is death rate, birth rate, disability rate, etc. So I have explained in the definition the three things which are given, that is the distribution and determinants of disease frequency. Distribution I have explained, determinants I have explained, and the frequency I have explained. Please remember, all the other definitions, customarily, the epidemiology is the study of distribution and determinants of disease or health related events in population and application of these to prevent and control the disease. You cannot remember or not, but please remember at least one definition. The third definition sounds same, meaning is same. It is given by Lilly and Field, and second definition is given by John Last. So as the time passes, different epidemiologists with different authors has given different definitions. Was the first important definition which is given by McMahon is the study of distribution and determinants of disease frequency in man. Okay. Now how it evolved? How the epidemiology evolved? How it was generated? Why the medical science thought that epidemiology should be discussed? Because when a large number of cases occur in an area within a short period of time, what it is called? Epidemic. So we have experienced in 2019 a very notorious disease, that is COVID, coronavirus disease. So it is an epidemic. That is the occurrence of a disease clearly in excess in number. And from this epidemic, especially the communicable disease, this epidemiology first started. But afterwards, it came to chronic diseases, non-communicable diseases, and other health parameters. In this connection, I want to say you that the disease domain, that means all the diseases, whatever could be, is divided clearly into two groups. One this side, another this side. The diseases in the left hand side or right hand side, when occurs in a person, it can be transmitted, communicated to other persons. Example, if you suffer from COVID-19, you may transmit the disease to your friends, your colleagues, your surrounding person, your family members. So this is known as communicable disease. And like this influenza, diarrheal disease, cholera, salmonella, Shigella, dysentery, tuberculosis, leprosy, all the diseases are transmitted to other persons, one person to other person. So these diseases are known as communicable diseases. This is the basic knowledge, please remember. And the other group, when occurs, it is not communicable to other persons. I am suffering from diabetes. If you come in contact with me, you will not be communicated with the diabetes. Diabetes is not transmitted to you, like influenza, like COVID. Amar COVID hole tumi amar kache asle, it may be transmitted to you. And those whose mother tongue is not Bengali, please learn Bengali, because you have to communicate with your patients. They do not know Malayalam, they do not know Hindi. So you have to, Bangla jani na kore, it is not an excuse. So you can ask question in Hindi, kya bokhar hua, but he is not very free to you. যখন তুমি বলে কি আপনার জ্বর হয়েছে, গরম হয়েছে গাটা, so he will be more. Language is another thing. If you go to London or Africa, if you find a same speaking, oh, apni Bangali, there will be automatically a connection. Oh, apni, you are Hindi speaking. Oh, you are speaking with him in English. Suddenly you discover that he is from UP and you are also from Bihar. So language is same. So please try to learn the local languages. 2 days before, one teacher, associate professor, joined in our department. He was talking with me fluently in Bengali. When I asked his name, he said, my name is BTK. What is BTK? He is your teacher also. He said, my name is B.T. Krishnadas. Well, are you not Bengali? Well, no, I am Malayalam. I am from Kerala. Because he was a student of Medical College, Kolkata. So during these 6 or 5 years, he learned Bengali so that a veteran Bengali cannot understand. He is a non-Bengali. That means Malayalam. So like this. দেখবে তোমাদের টিচার হবে, আসবেন, তোমাদের ক্লাস নিতে আসবেন, ওদের নাম হয়েছে পিটি উষা. The name is at the last part of the name. His name is B.T. Krishnadas. So another thing, you have seen during our discussion 3 coin words are coming continuously in all the definitions. One is frequency, second is distribution, and third is determinants. You see in these definitions, that is the distribution, determinants and frequency. Distribution, determinants and frequency, all these things. So what is frequency? Frequency means it is the occurrence. Literally means it is the occurrence. Occurrence of what? In medical science, the occurrence of disease, the occurrence of death, the occurrence of disability. So if you can measure the death, disease or disability, you have to summarize this all in frequency form, that is the rates and ratio, and you have to derive rates. What are the rates? Prevalence rate, incidence rate, all this will be discussed in your second year, third year classes. And incidence rate, prevalence rate, death rate, etc., etc., disability rate. Why we should calculate these rates? Because if anybody says, what is the health difference between the health status of two cities? Suppose this is the city A, that is the city B. Can you compare the health status of two? How will you? By this frequency, by these rates. We can definitely say the health status of India is better than Bangladesh. How? By measuring the death rates, by measuring the disability rates, by measuring the infant mortality rate, all these things. The infant mortality rate is this in Bangladesh and this in India. The maternal mortality rate, these terms will be explained afterwards. Just it is important to mention, that is maternal, that is the death of the mother during pregnancy and delivery, which is known as maternal mortality. Maternity mortality rate is higher in Bangladesh, in Pakistan than India. Definitely, if we compare the health status of India with USA, we are definitely lagging behind because our death rate, our disability rate, our incidence, prevalence of any disease, maternity rate, infant mortality, all these are more than USA. So by frequency, we can measure the health status of two places. Another thing, if you measure the health status of a place in 2019 and this 2024, that is after 5 years, how will you compare? By these frequencies. If you compare the frequencies of this same place in that two different calendar years at the interval of 5 years, 10 years, 50 years, definitely you will see whether the health status of a single place is improved or not. In India, at the beginning of this 19th century, a lot of people are dying from cholera, plague, communicable diseases, tuberculosis, but now you can rarely hear the name of cholera, plague, etc. So definitely the health status of India has improved during the last century. So, and another thing, suppose a disease is very much prevalent in an area. So as a health personnel, what you have to do? Or health administrator, what you have to do? You have to provide doctors, medicines, hospitals, etc. And you have provided. And if after 5 years you see the prevalence and incidence of the disease is same, what is your interpretation? That is, your action is in vain, or your strategy is not good. So what you have to do? You have to modify, you have to rectify your strategy so that it should be fruitful in future. And if you see, no, the disease conditions, prevalence has diminished, you say, we are going in right way. You continue, sustain the programs, or you have to rectify the programs, depending upon this frequency, comparing the frequency status. So this is the utility of ফ্রিকোয়েন্সি। আমার এখান থেকে আমি মঙ্গলবার আসি, তো বুধবার চলে যাই। তোমাদের ওই প্রোগ্রামটা একটু দাঁড়িয়ে দেখেছিলাম রাত্রিবেলা। বয়স তো হয়েছে, আর কয়েকদিন পরে 1-2 মাস পরে 70 ইয়ার্স হবে, যদিও লোকে বলে না। তো এনি হাও ঠান্ডা লেগে গেল, খুব কাশি। আমি ভাবছি আমাকে 2টো ক্লাস নিতে হবে বুধবার। এই ক্লাসটা নেব, এরপরেই আবার তোমাদের সিনিয়র ব্যাচের ক্লাস আছে। টিচার নেই, একাই চালাতে হবে। সুতরাং কি করে আমি ক্লাসটা নেব? তো কি করে সারলো যেন, ডোন্ট চার্জ অ্যান্টিবায়োটিক। এখন কোনো ডাক্তার বন্ধুর কাছে গেলেই আমাকে নানা রকম অ্যান্টিবায়োটিক অ্যাডভাইস দিত, বাট আই ডিডন্ট টেক অ্যান্টিবায়োটিক, আই টুক অ্যান্টিহিস্টামিনিক্স অ্যান্ড গরম জল, হট ওয়াটার। আর কি হলো, রাত্রিবেলা কাশির জন্য একটা কাপ সাপ্রেসিভ কিনলাম। দ্যাট ইজ দ্য, কিনলাম না, একজন মেডিকেল রিপ্রেজেন্টেটিভ দিল। ওইটাই মাঝে মাঝে খেলাম। ওটা লাস্ট আই হ্যাভ টেকেন ইন দ্য ডে বিফোর ইয়েস্টারডে। তো অটোমেটিক্যালি you always try this adjuvant drugs, don't charge antibiotic. This is not my advice in your chamber patients. চেম্বার পেশেন্টে কি হবে, একটু কাশি না সারলে পালিয়ে যাবে অন্য দেবে, সে আবার সে অ্যান্টিবায়োটিক দিয়ে দেবে, বলবে ওই ডাক্তার don't know anything. But this type of treatment will you do in your case and also for your close relatives. ঠিক আছে? So we have discussed frequency, events. Second is distribution. I have already told that the distribution of the disease is different in different places in the same country. In sub-Himalayan areas, hypothyroidism is present. What is hypothyroidism? Can anybody tell? Definitely. How? Hyposecretion of thyroid gland. Why? Yes. Good. This question can be answered from your knowledge of anatomy and physiology. We have a gland here, like a butterfly, isthmus and 2 sides. That is a thyroid gland. Now this thyroid gland traps iodine from our food and drinks. Good answer, good. So this iodine is converted by this machinery into thyroxine, that is T4 tetraiodine, and triiodothyronine, and so many others. But these 2 things, which are symbolically mentioned as T4 and T3 and T4, is a hormone, and it acts in the development and in the metabolism of the human body. So we get it mainly from food and drinks, and mainly drinks, and that is the water. The subsoil of sub-Himalayan area, it is trickled down due to gravity, and as it trickling down, the iodine is also coming down. So the people of hilly area is deprived of iodine. So as a result of which there is deficient production of thyroxine and triiodothyronine. So it is prevalent in, but it is not prevalent in plains. But it may occur. These young girls, some of them may suffer from thyroid deficiency. So it is the difference of distribution. Now in Kashmir, Khangri cancer is, Khangri cancer is present because due to they put charcoal filled handi over the navel. So as a result of which in the advanced age of the child may develop a squamous cell carcinoma. It is not present in any part of India. Third is the people of the southern part of India, they suffer more from gastric ulcers. Why? Because their food is more prevalent with sour and chili. So these are the examples of difference of distribution of the same disease in the same country, different part. So these are the things, this is the distribution. But why so? It gives a clue about the causation of the disease. You will think, why there is difference of occurrence of the disease in different, same disease in different parts of same country or different part of the world. So gives a clue regarding the etiological factor. And until and unless you know the etiology of the disease, you cannot treat. Suppose in a chamber, in an outdoor, you diagnose a disease. And after diagnosis, you know what is the cause. And what you have to do, you have to just oppose the cause. অপোজিট করে দিতে হবে যা হচ্ছে, এইদিকে যাচ্ছে ডিজিজ হচ্ছে, এটাকে এইদিকে ঘুরিয়ে দাও, there will be no disease, cure. So until and unless you know the etiological or cause factor, you cannot treat the disease. And third is, it is the determinants, that is the same thing. Determinants, epidemiology has basically two parts. One is descriptive epidemiology and another is experimental epidemiology. So by this determinants we can know, because for example we know now that smoking is responsible for lung cancer, but previously we do not know whether lung cancer is related with smoking. So by epidemiology we started to search what is the cause of lung cancer. These persons are suffering more from lung cancer and these persons are not suffering. We searched out that it is more prevalent among smokers. And in this way we came to a conclusion, after many experiments definitely, that lung cancer is very much prevalent in cigarette smokers. That is the smokers, not cigarette, it is bidi, maybe bidi or hookah. So epidemiological approach, and epidemiologist always ask these questions, that is, what is the event? Who is the sufferer? When the disease occurred? Where? And why? What is the magnitude? How many people died? So suppose in a party, শীতকালে এখন তো খুব পার্টি হচ্ছে, different types of food was ingested at night, and from the morning you see in the party 200 people participated, and in the morning you see about 100 people suffered from gastroenteritis, vomiting, diarrhea. So as a doctor, as an epidemiologist, you have to investigate in the case. Then your questions are, what is the event? Answer is, it is a case of food poisoning. Who are the sufferers? About 40% of the persons who attended this party are the sufferers. When it occurred? It occurred in the early morning of the day, about 6 hours after ingestion of food. Next is where? It is in that place. Why? Because they consumed these things. And magnitude is about 40% of the ingester who took the food. So these are the questions. Now, in the beginning I have told you that without knowing epidemiology, you cannot be a good doctor. Now, what is the difference? That is the difference between epidemiology and clinical. So, number one, the unit of study in defined population. The disease pattern of entire population, both sick and healthy people. Relevant data from epidemiological study goes to the community. Conceptual symbolized in tables and graphs, cases and individual population. তাহলে ডিফারেন্সটা দেখছো, একের সঙ্গে এককে তোমাকে ডিফারেন্ট কম্পেয়ার করতে হবে। ওখানে কি বলছে, ইন কেস অফ এপিডেমিওলজি দ্য ইউনিট অফ স্টাডি ইজ ডিফাইন্ড পপুলেশন, একটা ডিফারেন্ট পপুলেশনের উপরে স্টাডি করতে হবে। আর এখানে কি বলছে, এ সিঙ্গেল কেস, একটা পার্সন, একটা ইন্ডিভিজুয়াল। নাম্বার টু, ডিজিজ প্যাটার্ন ইন দ্য এন্টায়ার পপুলেশন। এখানে কি বলছে, এই ইন্ডিভিজুয়াল পার্সন। ওইখানে কি বলা হচ্ছে, বোথ সিক অ্যান্ড হেলদি পিপুল আর আন্ডার ইনভেস্টিগেশন, হিয়ার অনলি দ্য সিক পিপুল। Number four, relevant data from the epidemic study, and here is your diagnosis. The epidemiologist goes to the community, but the patient comes to the chamber of the doctor. And last point is, it is conceptual, symbolized in tables and graphs, and it is perceived by clinical and laboratory examinations. And if we are not satisfied with our diagnosis, the patient died, there may be post-mortem. Post-mortem করে তোমাকে দেখতে হবে কেন মারা গেল। তাহলে এরা ঠিক ক্যানট সাজাতে পারেনি, এই দুটো এরকম তলায় তলায় না লিখে পাশে পাশে। এটা কিন্তু গুড কোয়েশ্চেন ফর থিওরি। দিস ইজ এ শর্ট নোট ফর থিওরি। তোমরা পাশাপাশি লিখে নাও, 1 against 1, 2 against 2, 3 against 3, 4 against 4. This is the last part of our study today. Now, uses. There are 7 uses of, এখন তোমাদের একটু কঠিন লাগছে। Now it is very difficult to understand because epidemiology itself is very difficult. So in the first instance, it is a bit difficult to understand, but when you go, because we have to go in first year, second year, third year, fourth year. So during these 4 years, 3.5 years, you all will be clear. কারণ আমাদের এখানে প্রথম ব্যাচ ঢুকেছিল 21 সালে, 2021, and their examination is just in the January, last of January of 25. কারণ দেখছো 4 বছর পরে 21, 22, 23, 24, 25. After 4 years, the disease is, the examination is coming. এই দিক দিয়ে যাবে না, সামনে দিয়ে, পেছন দিয়ে যাবে, এটা নিয়ম। সো এই 3 বছর বলে কি হয়, ইউজুয়ালি ছেলেরা কি ভাবে যে সামনে একটা পরীক্ষা আছে, এটা দিয়ে নিই, তারপরে এটা পড়ব, তারপরে আর একটা পরীক্ষা এসে যায়, অ্যানাটমি, ফিজিওলজি, বায়োকেমিস্ট্রি পেরিয়ে গেলাম। তারপরে পরীক্ষা এলো কি প্যাথোলজি, ফার্মাকোলজি, এক্সেট্রা এক্সেট্রা, সেটা পেরিয়ে গেলাম। তারপরে বলে যে আমি তারপরের পরীক্ষাটা দেব। ইন দিস ওয়ে ক্লাস মিস করে, কিন্তু এই জিনিসগুলো তো আর পড়ানো হবে না। এইগুলো মিস করে বলে তাদের কি হয়, পরের দিকটা আর বুঝতে পারে না। এখন তারা হিমশিম খাচ্ছে, হাতে পায়ে ধরছে। তো যাই হোক, the uses of epidemiology is to study the historical rise and fall of disease in the population, community diagnosis. Number 3 is planning and evaluation. Number 4 is evaluation of individual risks and chance. All will be explained afterwards. And syndrome identification, completing the natural history of disease, searching the cases and risk factors. Acha, what is syndrome and what is disease? Idea আছে কোনো? What is syndrome and what is disease? Combination of these, not a particular disease. Example? হ্যাঁ, এইডস বললে ঠিক হবে না, এইডস ইজ এ ডিজিজ। কমন বলো না, ক্লাইনফেল্টার সিনড্রোম ইজ নট কমন। হ্যাঁ, হ্যাঁ ও বলেছে মোটামুটি। আচ্ছা, whether anemia is a disease or syndrome? ডিজিজ আমার কোশ্চেনটা ভেবে বলো, জন্ডিস সিনড্রোম অর ডিজিজ? ডিজিজ। আচ্ছা, ভেবে বলো। The question is open to you. So, in case of whether it is a syndrome or a disease, by epidemiology, you can get the answer. Ever epidemiology, in the light of epidemiology, you please judge whether jaundice or anemia is a disease or a এটা পড়ানো হয়নি। Now what is the aim of epidemiology? উদ্দেশ্য কি এপিডেমিওলজি জানার? Number 1, to know the magnitude of the problem. How much population in the community this develop these diseases? That means COVID. Example, how many people of your locality, how many people of your district, how many people of your state, how many people of your country suffered from COVID, and only your country or other countries? So this is the magnitude. When the disease occurs very minutely in the community, it is known as sporadic. And a bit large number continuously occurring, it is known as endemic. And if it is larger than that, what is that? Epidemic. A large number of people. And when a large part of the country and different countries over the geographical barrier is caused by the disease, it is called pandemic. Last example is COVID. And there are so many diseases: cholera, plague, influenza, and millions of people died in those pandemics. So this is the known as magnitude, ayoton, volume, and distribution. Which part? In last pandemic, we have seen that it is more prevalent in Europe and America, and it is less in Asia and Africa. Why? This is a matter of study. The epidemiology will find out. Even if I have seen that in our locality, the people of the well-to-do family suffered more from COVID, and those people who are called subalterns, that is the cook lady, that is the lady cook, maid servant. So all these people suffered from, did not suffer from this. এই তুমি কোথায় থাকো বলো? মেদিনীপুর থাকো। তোমাদের বাড়ির বা আত্মীয় স্বজনে কোভিড হয়েছিল কারো? হয়েছিল। আচ্ছা, তুমি কি দেখেছো তোমাদের বাড়ির কাজের লোক টোক এদের কোভিড হতে? সেরকম হয়নি না? So this is the peculiar thinking. This is the peculiar picture. You just remember, recapitulate your family status. I have seen none of the in our community of these people of lower socio-economic group developed, and if developed very scarcely, 1 or 2 in number. Why this? Is there any difference between genetic factors between them and us? Whether there is any difference between the socio-economic status of that people, that group of people and us, I don't know. It is a matter of study, and study is going on. The epidemiologists are analyzing, researching on these factors, and after few years we may get the result. But it is a fact that millions of millions people in Western world, Europe, America, Italy, USA died, but not so many people in India died. এটা তোমরা জানো তো? ইন্ডিয়াতে কিন্তু অত মারা যায়নি, but in Europe and in America so many people died, billions of million people. So this is the example of magnitude and distribution. Second point is to find out the etiology, as I have discussed, to know the cause of the disease, and until and unless you know the cause, you cannot revert the disease process. And pathogenesis, that is when the organism enters into the body, it multiplies, liberates toxin. The toxins will circulate within your blood, that will act on your target organ, and ultimately the disease will be established. This process is known as pathogenesis. So the aim of epidemiology is to find out the pathogenesis. And third is very difficult. It is to provide essential data for planning, implementation, and evaluations of the measures for prevention, control, and treatment of a disease. And also to give priority. What is priority? Can anybody tell? Hey, তুমি বলো তো, what is priority? বলো. You cannot know, do not know Bengali. You ma'am, first, second. What is priority? Who knows Bengali? You do not know? No? You say, তুমি বলো, দেখি আমার সঙ্গে বাংলায় কথা বলো। What is priority? Oh, the word written in the last word. Priority, what is priority? বলো, ভয়ের কি আছে? আমি কি খেয়ে ফেলবো নাকি? কে বলতে পারে? তুমি বলতে পারো? হ্যাঁ, মোস্ট ইম্পর্টেন্ট। সাপোজ in a family, very very poor family, no money, you have given him money, what he will purchase? Rice or atta and salt. And if there is some money, what he will purchase? Potato. Isn't it? No, this is a fact. You just think. तुम ये सिचुएशन में पड़बे ना, किंतु जार पैसा नहीं, जिसका पैसा नहीं है उसका तुम 100 रुपया दो, फर्स्ट ही विल परचेस according to his food choice, that is the rice or atta. Then he will purchase salt, then potato, and then mustard oil. And ultimately, if something survives, he will purchase egg or fish if he is non-vegetarian, or meat. So this is the known as prioritization. That is, rice and salt is more priority. He will not go তুমি 100 টাকা দিলে ও দৌড়ে গেল মাংস কিনতে, যাবে কি? কখনোই যাবে না। He will purchase first rice and potato and salt. Just ফুরিয়ে গেল, কিন্তু this is sufficient for him, for his food, this rice, potato or atta, potato and salt. If some money is saved, he will purchase oil, he will purchase egg or fish or meat. So this is called prioritization. So in case of medical services, we also care for prioritization. 2 patients comes in your emergency. Suppose you are a emergency medical officer. This side one patient with coronary heart disease. He has no pain. He is just lying very silently on the bed, semi-unconscious. When you examine his pulse, you see it is very feeble. If you check the blood pressure, you see you cannot record. There is cyanosis due to bad circulation of the body. He has none with him. Just the police has taken that person, suppose a street beggar, he is just lying silently. আর এদিকে কি হয়? একটা ছোট বাচ্চা, that is the scorpion bite. In scorpion bite, there is severe pain in finger. And he was surrounded by a lot of people. One politician, hey ডাক্তারবাবু চিকিৎসা করুন, আমার পেশেন্ট লাফাচ্ছে, কাঁদছে, চিৎকার করছে, বিচ্ছু কাট লিয়া। What will you do? এখানে কি? Just you put lignocaine injection 1 or 2 ml, একদম ঠান্ডা হয়ে যাবে, পরিষ্কার, ব্যথা চলে যাবে। তুমি ওইটা যদি করতে যাও, the patient will die. You just see the difference. Here the patient has nobody, he is very silent, he is a beggar, and here it is a child which is মাথায় করে ফেলছে একদম গোটা হসপিটাল, চিৎকার করে, উইথ পলিটিশিয়ান গার্জিয়ান। তাহলে তোমাকে কোনটা আগে করতে হবে? Definitely for the demand of the situation, you have to treat that more least important patient. কিন্তু ততক্ষণ তুমি গিয়ে দেখলে ও শেষ। So here you have your judgment, here your conscience as a doctor to treat him. এটাকে একটু পরে করলেও হবে, চিৎকার করুক না, আর একটু চিৎকার করুক। কিন্তু ওখানে যখন তুমি গেলে পেশেন্টটাকে বাঁচিয়ে তুললে, এই পার্টি তোমাকে আধমরা করে ছেড়ে দেবে। বুঝতে পেরেছ? This is a situation when I just passed in medical college, and this situation came many years before, about 45 years before. I am then a young medicus. So you have to prioritize according to case merit. There must be given weightage more, but according to your political situation, you have to give more weightage. Now I just hand over to you, to whom will you give more weightage. Okay, thank you.